Hello everybody, thank you for taking the time to watch this video. The following presentation has been produced by Lion Health, formerly known as Worcester Street Surgery. This video is designed to run alongside our online blood pressure management service known as In Control, and we would suggest that you use this alongside the advice from your healthcare professional. Hello there, my name is Dr. John Woolley and I'm one of the partners here at Lion Health. I want to thank you for taking the time to watch this presentation, which is the first of 3 presentations designed to explain in a bit more detail about cholesterol. Cholesterol is a really important risk factor for future cardiovascular events. And what I want to do today is go through a number of things and hopefully explain what cholesterol actually is, how it causes damage to our blood vessels, how it gets to the blood vessels to cause that damage, because by doing this then we should hopefully be able to put your cholesterol results into a little more context, and we finally then want to discuss what your cholesterol results actually mean. It's widely accepted that cholesterol is a big risk factor in clogging up our blood vessels and therefore putting us more at risk of heart attacks and strokes. So I want to start just by recapping on what cholesterol is, because although it does get quite a lot of bad press as a result of these problems, cholesterol does actually do some good for us, and it's important not to forget that. Cholesterol is actually quite an important player in the strength of our cell walls, and it also plays a role in the production of some very common hormones that you may have heard of, such as testosterone and thyroxine. But we often focus quite rightly on its negative effects, and this is because in relative terms cholesterol levels need to be very small in order for it to do its good stuff. That means that all of the cholesterol that's left over is unfortunately able to play havoc with our blood vessels. What I'd like to do now is just explain a little bit about how this bad aspects of cholesterol actually occurs. Too much cholesterol poses a problem to blood vessels, and the following slides are designed to show this. Firstly though, let's recap on exactly what blood vessels are. It's really important to see blood vessels just like a tube or a pipe. They have walls and they also have space in the middle. And it's this space which allows blood to flow through it. As you might imagine, the bigger the hole, the more blood that can flow through it. And it's this width or diameter which plays quite an important role in our cardiovascular health. So where does cholesterol come in? Well, too much cholesterol unfortunately has a tendency to get deposited in blood vessel walls, and this effectively causes the blood vessel to narrow. As mentioned earlier, when blood vessels narrow, there's less room for the blood to get through, and when this happens, the narrowing is known as a plaque. But what are the consequences of having narrowed blood vessels? Well, a lot of it depends upon where the pipes are sending blood from and where they're going to. For example, if you narrow the blood supply to the heart, then you're going to increase your risk of conditions such as angina and heart attacks. Similarly, if we narrow blood vessels going to our brain, then we're putting ourselves more at risk of things like strokes and types of dementia. But it's also really important that we don't forget blood vessels transport blood to other important organs, such as the kidneys and our eyes. So if what we're saying here is that cholesterol getting deposited in blood vessels causes them to narrow, and it's that effect which causes most of the problems, we need to try and understand how cholesterol gets in our blood vessels in the first place. And perhaps just as importantly, explain why understanding this is of any importance anyway. So let's first recap on how cholesterol gets into our blood vessel walls. Cholesterol cannot dissolve in blood, and therefore in order for it to get from A to B, it needs to be carried. And this occurs via carrier proteins. There are two main types of carrier protein, both of which you may well have heard of before. The first carrier protein that we'll talk about is known as LDL. LDL stands for low density lipoprotein and is often referred to as bad cholesterol. LDL gets this nickname by virtue of the fact that it takes cholesterol to the blood vessel wall and deposits it there, hence why it is responsible for cholesterol's bad effects. The more cholesterol we consume, the greater the number of LDL carrier proteins are produced by the body, and this has a net effect of sending more and more and more cholesterol into the blood vessel wall, causing it to narrow. As you can imagine, the lower our LDL, the better. Although it is important to remember that there are some genetic reasons as to why we might have more of these proteins. But we can't get away from the fact that diet is absolutely crucial in how much our body produces of this particular type of protein. So it's really important to make the point again, LDL cholesterol is what makes cholesterol damaging to blood vessels. So we've spoken a little bit about bad cholesterol, but what about good? Because there is a type of carrier protein known as HDL, which is thought to help remove cholesterol deposits from blood vessels. And that's why you'll often find HDL, otherwise known as high density lipoprotein, referred to as good cholesterol. The more HDL cholesterol we get, the better, primarily because HDL is able to reduce the size of cholesterol deposits. And as a result of that, the next key point to remember is that HDL cholesterol is actually a stabilising force and helps reduce cardiovascular risk. So what we've hopefully done is described what cholesterol actually is, explained a little bit about how cholesterol is implicated in causing future cardiovascular problems, and also explained how cholesterol gets into our blood vessels in the first place. By having a basic understanding of this means that your cholesterol results can be placed into a much better context. In the next video, I'm going to discuss cholesterol results in a little bit more detail and give a few tips on what it is that we as clinicians look for in order to help define whether somebody has high, normal or low cholesterol. Thank you for taking the time to watch this first video.